It's time today to meet with the director of Elko Senior Center. Welcome, Matt McCarty, to KELK. We always look forward to our visits.
Thank you so much, Lori. It's always a pleasure to be here, and we're honored that you give us the time to be able to share with our community what is happening at the Elko Senior Center and what's happening with senior health and anything else that we might be able to do to help our community and oftentimes also to seek help and seek support from the community at the same time.
One of our most popular places, of course, for a delicious meal every weekday starting at 11:30, Matt. And then, as you said, sometimes there are extra things that we could do as a community to support our senior population. And I'm glad that you mentioned health because I know you have a list of topics that we'll go over today, but even in the last week or so, some confusion about the COVID-19 vaccines. And we know in the past that our senior center has been able to host vaccination clinics for various vaccinations.
Yes, and we're actually still trying to work on 2 different vaccination clinics with 2 different partners. This will most likely include COVID if it's available, as well as influenza vaccinations. And then sometimes we're also able to get in some of those more regular but longer period vaccinations, such as shingles or tetanus or things like that. So it just depends on the provider and what their stock is. And we also have to try to get some of those counts in advance. With the COVID and the influenza, it's a little bit easier for them to just bring a stockpile. But with others, like the shingles, I think it's the shingles vaccination has to be refrigerated at a certain temperature, and so they only bring a few to make sure that they don't go bad.
It's kind of like the Meals on Wheels delivery. You just can't put on too many miles. So nothing yet, but
I will certainly have something by the next time we're on the air, and then we'll also have something in our newsletter for October. I have no doubt on that.
Oh, perfect.
I can't believe and we're supposed to send it to our publisher in 5 days. So we'll hopefully have something soon.
All right, that sounds great. Again, just inquiring about, as a lot of seniors are and other people in the community, about the availability of vaccinations because flu season is upon us. So
it is, and I've had some questions, and so I want to make sure that folks that are listening know that the COVID vaccine has not been banned in Nevada. I had 2 or 3 different people come up and say that they'd heard it had been banned in Nevada. It's not been banned in Nevada. The Nevada State Legislature has not taken that action. The governor's office has not taken that action. So whatever may be happening at the national level doesn't mean that it's going to automatically take place in Nevada. Now, with that said, actions at the national level will have an impact on nationwide and even global supply. So that does make a difference as well. And there may be additional costs this year that folks should be prepared for, and there may even be some insurance agencies, regardless of whether you're on Medicare or not, that may not be able to cover the full cost as they have in the past. So just be aware of that and always talk with your healthcare provider in advance. Let them know that you'd like the vaccination. If you don't get it through a vaccination clinic, such as what we will hopefully have at the senior center, and just make sure that you know what it is that you're getting and what it may cost you. Hopefully it still is a free, if not relatively inexpensive vaccination. But just, again, we don't want you getting a sticker shock of all of a sudden getting a bill that you weren't expecting. So always talk with your provider in advance.
Matt McCarty is director of our Elko Senior Center at 1795 Ruby View Drive. And thanks again, Matt, for reassuring folks. Whether or not it's reassuring, we're still, we're on the doorstep. But I think that's the best advice. If you are so fortunate to have a healthcare provider, make sure you consult with them and do that now. And you can also walk in and get free flu shots. I got mine last week, and it was at CVS. So those are being offered, and you can take that shot and be on your way.
Yes, absolutely.
No charge.
Coming up soon, the hospital, I'm sure, will do their annual drive-through vaccination clinic as well for influenza.
All right, so those are really important. Don't get so focused on COVID-19 that you forget the other vaccinations too.
Yes, absolutely not.
All right. So other things that we want to mention, as you said, we're We're going to be on midway through September already, and I know there are a lot of exciting things to look forward to as a community, and the Senior Center is in the thick of it.
Absolutely. Personally, I always enjoy the fall. I do enjoy the change of colors. I enjoy the cooler mornings and the cooler evenings. And I know that many of our other seniors don't quite care for that, and we have a number of snowbirds. And this is the time that, while it's an exciting change and we start to get ready for the end of the year, we lose some friends as they travel southward. So that's always bittersweet. But it's also just it's that time. I heard somebody say the other day, it's pumpkin spice season. And while I'm not a big pumpkin spice fan, I recognize that as we start to get warmer weather and hopefully we start to gather together more around the hearth and just again enjoy some of those warm family moments with friends included.
Our Senior Center, of course, is a haven for a lot of our seniors and their family and friends. And I know we have look forward to meals. How are meals going? I know that's something we've talked about too. I just wanted to check in with you, make sure we still have enough resources.
We are still doing okay. We did run out of funding through the state for our Meals on Wheels program, and so we had to pause new applicants and new members to our Meals on Wheels program. We have about another 20 days before we can get that cleared back up. On October 1st, we are expecting our funding to be resumed from the federal level. And I want to be also clear that the State of Nevada Aging and Disability Services Division is a terrific partner for us, and it wasn't that they cut our funding. I've tried to make this as clear as possible. It was a matter of us being too successful, and we just grew too fast. And so we ended up using a 12-month budget in a little less than 9 months. So we had so many people that were new and that came in. I just didn't anticipate that growth, and so I didn't ask for enough money, and so therefore we didn't quite get what we needed. So we are going to, though, hopefully get our full funding in October 1st, and that will renew that, and we'll be able to continue moving forward. But to your point, how are meals doing? Meals are great. Our congregate dining room still is doing terrific. Today was one of our lighter in not necessarily, I guess both in attendance and in the meal itself. We had a really good chicken noodle soup, and then we also had a turkey salad sandwich. And so it's not one of the ones that they bust down the doors to come in and get, but we still had well over 100 people in our dining room.
That's actually very impressive. I thought you were going to say far less than that because, hot dog day is when they bust down the doors.
They do, yes, absolutely. And so, yeah, it's good to see that. We are almost always averaging well over 100 people. Our numbers in the past 3 months have been actually hovering closer to about 117 people a day, which is great. I'm pleased that our community trusts us and values us to be able to provide those nutritious meals, and I seem to think that means that we're doing something right. And it's great also because it's not just about food, it's about socialization, and we are social creatures by nature, and being able to visit, it's been proven, visiting with other people and staying active socially leads to longer lives and healthier lives as well. So we're glad that we can be just a little tiny part of our community's health.
Well, we can give back too by contributing, say, to we used to call it the Nurses Bazaar, but now it's an Elko Senior Center Christmas Bazaar, and now's the time to start making plans for that, right?
Absolutely. We, in fact, Carissa, our assistant director, and I are a little bit behind the calendar, and we're running a bit late on making sure that we have all of our vendors, but we are getting vendor contact weekly and making sure that we have folks coming in and that we have enough vendors for our community to be able to shop with. And yes, you are welcome to help us at the bazaar by donating items that you think would be well received by others. And we're not necessarily talking about donations of gently used items or things like that, though we may be able to use them. But there are other organizations in town that could certainly use those perhaps better than we could. Ruby Mountain Resource Center does a great job, as does Fish. And of course, we have United Cerebral Palsy. So there are a few different places in town those items can go to. But if you have handmade items, if perhaps you've crocheted or knitted something, or if you woodwork and you have something that you'd like to donate, we have a beautiful box that one of our members created, and he took the time. It's multiple colors of wood that are inlaid into each other, and he cut some wood really, really thin, and I'm assuming soaked it, because then it was bent up and formed into a bow, and it's just an amazing piece of work. And so he's donated that to us for us to be able to sell, because at the bazaar we have about 70 or so vendors, but then we also have a table up front for items that have been donated to us so that we can sell those as well, and we call that the senior table. And on those items there, and I want to make sure that folks know, if they are donating, we don't price those items. We put them out there, and if somebody is interested in them, then we ask them to make a fair deal. Just like our meals, give what you can, when you can. And so that's what we are kind of doing with our senior table as well, and the gifts that are donated to us. We ask the potential purchaser to give what they can and what they feel is a fair price for that.
Very nice, Matt. So again, if you're going through items, cleaning out, or you've made an extra quilt or some woodworking or crochet, as you mentioned, might consider donating that to the Senior Center for the senior table. The Christmas Bazaar will be in December, but it'll be here before you know it. So,
it will be here
yes,
before you know it.
definitely.
Yes, absolutely. And it's that first full weekend in December, so that Saturday and Sunday, and it runs in conjunction with the Festival of Trees on Saturday. I know that the Festival of Trees is that week, and then it ends on Saturday, and then Sunday we are at the E-Center on our own, but it's a great partnership to still be able to be there on Saturday with the Festival of Trees.
Thanks, Matt. Matt's always thinking about those great collaborators in our community as well. As the seniors support the community supports the seniors. So it's a nice opportunity to give back. Thought I might just check in and see. I know over the summer we announced the fundraising drive to acquire land, and it might be a little slow to ramp up, but hopefully we're helping get the word out on that, Matt.
Yes, ma'am, and I appreciate that. And so far we have about $130,000 towards that, which is amazing. And we have a few donors that we've also visited with that might be able to bump that up a significant amount. And so we're very thankful for that. And the grassroots side really hasn't quite yet begun. Again, it's been an interesting month so far, and we're only 10 days in. I haven't gotten out some of the letters and the appeals that we'd like to get out, but soon they'll be hitting the doors of the mailboxes, I should say, of our business community, and then through that, hopefully, to the rest of the community as well.
That is impressive, though. $130K out of about $1 million, but you've got a few months to put this together. And again, our job is just to help get the word out, make sure people are aware, whether you're a civic organization looking for an amazing cause, certainly, or a business, or even an individual. Sometimes people are planning their estates. Sadly, if they don't have someone to give to, if they can make plans to give an estate, that way it doesn't just go to the state of Nevada for taxes, for example. So.
Absolutely, yes. And we would always appreciate the thoughtfulness that goes into that. In fact, just today we had someone call and said that they needed some help with their own estate, that they didn't have any heirs and that they had multiple pieces of property. And so we were able to connect them with one of our partners, Nevada Legal Services. And so we're hopeful that not to come back to the center, but that this individual, this member, can find peace of mind knowing that their estate is going to be taken care of and that it's going to go to the places that they want it to go to. And that could be as simple as, help me to consolidate my estate so that we can start selling it, because one of the things that she said is, she said, I live alone, and at some point she's anticipating needing to go into a facility that will have a more full-time care for her. And so this helps her to start getting things together, and that's what we try to do is just make the connections. We don't have all of the answers, we don't have all of the resources, but we can certainly try to put people in the right direction and get them the help that they need and want.
Matt McCarty is the director of the Elko Senior Center. We sure appreciate your time, Matt, and again, talking about these important issues. Want to make sure that we're getting to everything that's on your list, because we know there are always ongoing activities, opportunities, and workshops, as well as services and referrals.
There are, and I appreciate that. And one thing before we go too far off of the land purchase that we're looking at, another thing that some people don't recognize or aren't aware of is at a certain age, if you have a retirement account, the IRS requires a distribution. And so you have to withdraw some of that money because they don't want it apparently the government doesn't want it growing and getting tremendously huge. So they require you to take some of those distributions. So talk with your financial advisor or your financial planner. And if there is some money that you need to take out, but yet you don't necessarily have a use for that money or an immediate need for that money, one thing that could be tax advantageous is a qualified charitable distribution. Certainly, we would hope that you would consider the Senior Center, but there are so many amazing organizations in our community that you can give to, and consider that. So talk with your financial planner, talk with your advisor, and they can help you with that. Talk to your accountant or your whoever prepares your taxes, and as you get to the end of the year, consider those qualified charitable distributions, I believe they're called. So
that's great advice, Matt. Thanks again. Some people are just not aware because it seems like the autumn years creep up on you all of a sudden. You're saying, wait, I was enjoying summer. How did fall suddenly arrive? So
absolutely. When I was driving home this morning from workout right in front of Spring Creek High School, the temperature was at 40 degrees.
Wow.
And I thought, okay, again, I like the winter. I like the colder temperature. And I was watching it. I was driving safely, but I was watching it to see if it would break 40 because then I get really excited.
Yes.
So, but yeah, it does. All of a sudden, those temperatures for summer evaporate and they kind of go like the leaves. They start falling, and that's what we get, and that's our beautiful area that we live in.
That's right, and of course that was my metaphor for aging too.
Yes.
So
yes.
Yes. So don't let it creep up on you. Be prepared for sweater weather if you're a senior.
Absolutely.
So what else is on your list?
So I also wanted to talk a little bit about Medicare and there's a term for it, and it's basically the open enrollment period, the AEP, I think is what they call it, something enrollment period. But all people on Medicare, this is their opportunity to be able to consider what their coverage is, and are they using the right coverage for the right price. So we have some folks that can help with that. We have a couple of partners. Golden Years Solutions does a terrific job, and that's Kristen Rowe, and she has a number of partners, including Risa Sidoris. I'm sorry, Risa, I know that you've married, and it's no longer Sidoris. But anyway, so she's got a number of people that work with her, so we can help get in contact with that if anyone needs that. And then we also have Access to Healthcare. And in fact, Access to Healthcare will be working with the Medicare and Elko Working Group to be able to put on in a workshop specifically for this open enrollment period. And that will be probably the first week of October, before the 10th of October or so. And it's most likely going to be at the Senior Center. So keep an ear out for that. We will have that in our newsletter for October as well. And I'm sure that Larry Heislop and his team will be advertising as part of the work group, and then, of course, Access to Healthcare as well. So we have a couple of partners that we can redirect you to if you have any questions on Medicare. And for those that are on Medicaid, remember that the state of Nevada is changing the way that Medicaid operates. This is a new way in the state of Nevada, and it will have some impacts. So if you have questions on Medicaid, I certainly suggest that you contact Access to Healthcare. There are a couple of other contacts that we can provide if you would like to call the Senior Center at 775-738-3030, and we'd be happy to help you with that. We'd also be happy to happy with that, but that just doesn't sound as good.
We knew what you meant, though, because we do it all the time.
Yes, ma'am.
Yes. Oh.
I think as we have a few more minutes left, I certainly want to thank again one of our partners, the Food Bank of Northern Nevada. Today was Produce on Wheels, and they do an amazing job. Sean comes up and he brings a truck full of fresh produce, and our seniors are able to get this produce. And it's great to have it come to the center so that we have folks that can pick that up there. And that's once a month. And if you have any questions on that, give us a call. It's once a month, and it's only for an hour. So it's a very short time frame, but we are happy to give you information for next month as well. Typically, it's going to be the second Wednesday of every month, and it's pretty rare that they have to cancel. Weather is about the only time that schedule is interfered with, because it's very rare that we have a holiday on at that period. So Christmas would never really impact it, but occasionally Veterans Day might. So just be aware of that. And another great partner dealing with food is the Nevada Department of Agriculture. And so last month was the first month that we started distributing Nevada Department of Agriculture food boxes, senior food boxes specifically. And this is the Commodity Supplement Food Program, CSFP. Of course, the government loves acronyms. And so through NDA, the Nevada Department of Agriculture, they provide food for up to 160 seniors once a month. And so they send us big pallets of food and cases of food. We then break it down and package it up. And it's similar to what our food pantry was previously, though we've put our pantry on hold for just a little bit so that we can get this program up and running and make sure that we're doing this properly. Key difference is that this food box, everyone gets the exact same food box. Our pantry, they could kind of have a shopping list and tell us what they preferred. In this box, it's always the same. They will always get juice, half a gallon of juice, I think it is. They'll always get 3 cans of fruit, 8 different types of vegetables or something similar with soup in there, some cheese and some milk. They also have 3 different types of protein. Perhaps it's tuna or salmon or beef or chicken. And then some plant-based proteins, so beans and peanut butter, etc. They will also have rice and pasta, as well as some cereal, both like a cornflake or something similar. And then also we try to get some oats in there. So there's a number of different items there, and that's once a month. The pickup for that will be next Tuesday. So if somebody is interested, this is an income-based qualification. So if you think you may qualify on the income levels, then please call the Senior Center or stop by. And as Lori mentioned earlier, we are at 1795 Ruby View Drive. Come on by. Generally, we're usually available between about 7:30 and 3 or so. And come on in. We'd love to have you come for lunch, 11:30 to 12:45, and then we can also help you through the food box or any other resource that we might be able to connect you with.
That's great. Wonderful news. And just as everything now that either it might be new and emerging or it's something that the community has relied on, do we feel pretty secure about the distribution, Matt? I mean, are you hearing good things about that?
We are. In fact, we are closing out the fiscal year for the state through this fund, and I want to make sure I'm clear. The state's fiscal year isn't closing, but the state distributes this through federal grants as well. So because the federal year is ending, this program's fiscal year is ending, and we just signed up to do all of next year. So we're anticipating that for at least the next 12 months, we'll be able to continue to distribute the food. And what's really great about this is that because it's coming through the United States Department of Agriculture to the state Department of Agriculture, this is grown in America. This is U.S. product and U.S. produce. And that's part of why this program exists, is to ensure that our farmers and our ranchers and those that are growing our agricultural products in the country have stabilization. We don't want to see farms and ranches close because they don't have enough ability to be able to distribute their product. So the USDA purchases these types of items in bulk specifically to ensure that on rough months and perhaps even lean years, our agricultural producers are still being able to be stabilized.
That's great. Thank you, Matt. And then, of course, our seniors have a pantry that's stocked full of nutritious foods other than the non-perishables, but they can certainly rely on things like the peanut butter and any canned fruits, vegetables, that kind of thing. That's really good news.
Yeah, absolutely.
Yeah.
And for those that are wanting to know when we'll bring our food pantry back, we hope to have it by January, certainly, and we may be able to get it in by November or December, depending on how steep our learning curve is and how quickly we can accommodate that.
Thanks again, Matt. There's so many things and activities happening, whether it's fitness, the wellness, the food and nutrition programs, legal services, certainly a limited amount of healthcare or at least referrals of where folks can get healthcare, right?
Absolutely. Yes, ma'am.
We appreciate all that. So, yeah.
Thank you so much. And as we get ready to close for this month, the temperature's dropping, but it's always warm at the Senior Center, so come on in for a meal.
Thank you so much, Matt. Again, today's delicious meal was chicken noodle soup. I didn't look ahead to see tomorrow, but I know it's going to be something equally nutritious and delicious. And all we need is you to join the Senior Center, 1795 Ruby View Drive. You can get by ride through Elko County's transportation, Greater Elko Area Transit. And tomorrow's lunch is going to be
Chicken fried steak, a popular one.
another popular one. So be there. It's Elko Live, and our guest today is Matt McCarty. He is the director of our Elko Senior Center. Thank you, listeners, for joining us today.